Yeah, again, Shannon Akers, CTO for Kincell Biosciences. We're based in San Francisco in the Mission Bay area. So the company really is technology is focused around modulating that tumor environment around conditions to mimic a tumor microenvironment, or really an in vivo environment from the outside. Currently, we have a lot of different instruments that are out there, but I want to give you an update on a little bit of what we're doing about taking the technology to the next step. So again, we're VC funded, primarily the last Series B round by the two founders, James Lim and Brian Feth. That round was led by Kasdan Capital. Actually, what's interesting, this year is the 100th year anniversary of the Warburg effect, and Odo Warburg's finding that, really glucose uptake and lactate production amongst different cell types, specifically different cancers in his work, is different among different, again, cell types in the presence and absence of different amounts of oxygen, and kind of leading to this anaerobic and aerobic effect that we use in our cell culture work today. And it is more pronounced, obviously, in the solid tumor and the tumor microenvironment. So, 100 years later, we're still struggling with some of these same issues, but yeah, a lot of companies like ours are trying to address those. So specifically with solid tumors, there's been limited success from a cell therapy standpoint, and making cells that are ready to go into that harsh microenvironment. Again, it's a high pressure area. It's a necrotic area, hypoxic area. pH is different. The immune barriers are a challenge, and how we've gotten to the point from using hematological malignancies and everything that we've studied and advanced in that space, and how we take those learnings into solid tumors. And so, again, as that environment's very different, how do we tackle those obstacles? So from our technology, we really do want to condition the immune cells to get over those hurdles within the suppressive environment of a TME. This is a funny depiction of where kind of how we view how we train these cells to go into a harsh environment, and really how we just overall train the cell from whether it's metabolism, whether it's a cell phenotype that needs to be adjusted to be able to get over those hurdles. And so we are taking that viewpoint of looking at overall training from an environmental condition standpoint of those cells. I mentioned metabolism. So one of the models that we typically talk about is these bicyclists and trainers in high altitudes to really condition mainly some of their hemoglobin mass when it comes down to how much oxygen do they need, how much oxygen can they retain to be able to keep moving. In the case of bicycling, how fast can they go? Within the immune cell therapy space, specifically to T cells, there's a lot of advancements and recent work to look at how oxygen levels as well as pressure changes those metabolism effects, whether it's related to activation, transduction efficiency, specifically to hypoxia. We commonly look at a lot of these variables, but some of them go unnoticed, like pH, in an acid environment, a more acidic environment than typically in what we call normoxia, and just a standard incubator where we keep everything at 7.2. Once those cells go in vivo, it's a different world, and we really need to look at how we're conditioning those cells. So again, from our standpoint with our technology, we're trying to mimic the tumor microenvironment and understand more of the metabolism that's going on within those cultures. Specifically, the two different levers that we adjust is hypoxia and regulating different gas to change those gas environments. That's typically what we again call a normoxic environment, 5% CO2. 16 to 20% DO levels. Those aren't the environments that the cell is going to have to act in. So again, our technology, as you see to the right, this is the first incubator, if you will, diminutive incubator that is agnostic to different consumables, whether it's plates, bags, whatever you want to put in that, as well as the hydrostatic pressure that we can apply. So if you can see that the form factor for the incubator is a little bit different than the standard incubator, where we want to keep pressure, be able to adjust pressure and keep it stable and constant throughout the culture. There are a lot of different technologies that will change hypoxia, change gas, change pressure, but the issue is keeping that stable throughout the life of the culture. And again, it's one of the things that we're looking to address. So an update on the company. Again, we have the research use only Avatar incubator that is commercially available now. Most people use it to again look at their target phenotype, whatever they're looking at for from whether it's metabolism, whether it's cell killing, any kind of providing that the environment that's more TME like. Avatar AI is it's in beta testing phase right now. Real-time label-free cell killing analysis. So it's providing that TME-like environment or in vivo-like environment, but then using an impedance-based system to measure cell killing. And then the one that is coming up is the GMP system called the Avatar Foundry. That system will take the core technology that's provided in the Avatar and the AI, regulating that environment and put it into a GMP state where we can control fluidics. It's got a software dedicated to environmental control, perfusion to be able to exchange media so the cells never leave the container. Because again, one of the issues that you have when you're trying to provide a TME-like environment is every time you take it out, take the cells out to the BSC, you're handling those, you're actually taking them out of that environment that you're wanting to keep, and the gas fluctuations and pressure fluctuations drastically affect the cell type. So how much of this can we automate in a GMP device, and then and be able to be inserted into someone's manufacturing process. The GMP Foundry system is meant to be modular. If you look, this is a typical manufacturing process for T cells. We do play in this activation, transduction, and expansion. So, there's a lot of literature out there, and we're doing a lot of internal studies, specifically how pressure and hypoxia can increase activation, can increase transduction efficiency, provide more cells, and provide more potent cells. We're not just trying to get more, bulk cells. We're super interested in phenotype. We're super interested in what these cells can do coming out of this conditioned environment. We also want to stay, within the space of automation as things move into a more automated environment. One of the hurdles is every time somebody has to get into a clean room to even take a sample, it's a cost, it takes time again. So how do we make the system that's compatible with future automation? So earlier this year, we announced a collaboration with Cellular Origins, again, as they build their automation platform for media handling, again, removing that clean room personnel within those touch points. How do we stay compatible with that? Also within our modularity space. Again, because of where we play in the expansion, that's where in a T cell manufacturing process that most of the T cells spend the majority of the time. So again, that's a really critical point for us to make sure that we are still focused, and as well as we provide that environment, how do we stay compatible with future automation? I mentioned touch points, again, with the Foundry GMP bioreactor. A lot of touch points depending on what your process is, whether it's manual or modular, and maybe parts of that are automated and other parts aren't. So again, focused on the expansion step, but also taking into account activation and transduction and transfection and gene editing technologies. How can we automate as much of that as possible? Some of the early data that we generated have been with CAR-T and TILs. I'll give you an example. This is a TIL from bone marrow, to where healthy donors conventional hypoxic environment that's kind of, I would call, a little not, I wouldn't say clunky, but not really controlled compared to the Avatar. All the data that you see now is in the Avatar, not in the GMP one that is still in development. It will be available for beta testing in February. But you can see that we can actually get an increased fold expansion by our Avatar environment, which is controlling those parameters. And with patient material, with multiple myeloma material, we get that increased fold expansion, and we actually can decrease those exhaustion markers that a lot of people are looking at. Again, that's part of that preconditioning effect that our technology is providing. With the gene editing step, again, we're a little agnostic to whether you're doing transfection, transduction, whatever this is with a partner company, Selfie. Where we can look at preconditioning and post-transfection conditions in an Avatar environment. Again, standard incubator, which is just what we call normoxia, versus different levels of oxygen and under pressure, where we see that in this case we were knocking out PD-1, and we see an increased knockout efficiency, as well as to the right we see increased live cell recovery from providing that condition. We did some early work with John Lee, who was at Fred Hutch, now he's at UCLA, where he's looking at STEAP1, which is a prostate cancer antigen, trying to increase both here on the left, again, transduction efficiency. It's a CAR construct that he's using, so we're able to see increased transduction efficiencies as well as tumor killing. So again, as we're focused on making more potent cells, assays like tumor killing and serial tumor killing are really important in a lot of people's development, and it's one of the main parameters that we evaluate. In this case, with the STEAP1 CAR T, we see better, those cells provide more cytotoxicity to the target cells when they were in a TME environment. Collaboration with Jefferson Institute of Biotechnology, looking at enhanced transduction again. This is with a CD19 construct that they have. We were focused on looking at how pressure regulates transduction efficiencies, and you can see as you we can turn we can adjust these parameters in the incubator. So you can see as we go up in pressure, our transduction efficiency actually increases, but also they're very interested in post-thaw viability. So as you can see in the bottom right, thawing those cells and culturing them under a pressure will actually increase those viabilities. So it's something that we're currently evaluating as well. Very focused on, again, phenotype, resonant memory T cells. In this case, we're in, whether it's T cells, TILs, whatever the cell type is for that specific, whether it's activation, transduction, or expansion. We're focused on whatever keeps those cells as potent as possible under the TME. So resonant memory T cell phenotype is one that we're interested in. You can see that actually in an Avatar condition compared to standard incubator, it is more pronounced. I mentioned serial killing. This is obviously something that is getting more focus in the last couple of years as we're looking at potency. So this study was done with R1 CAR T cells a little while ago with Lyle. Again, as you see this tumor challenge from 1, 2, 3, and 4, the normoxia in the black line really kind of goes away after that fourth challenge. In the blue line, which is the Avatar expanded CAR T cells for ROR1, you can see that those cells are actually more potent over time and retain that potency. And we can actually do pre-cultures of these as well. Lastly, in my final minute, I do want to talk about the GMP device that we're working on. Again, as I mentioned, it's focused on cell activation, cell transduction, and cell expansion efficiencies related to, again, potency, with that factor of metabolic conditioning to boost more therapeutic, potent cells, as well as staying automation friendly with liquid handling, metabolic sensors, things that, so again, removing the need for the user, the GMP, somebody to go into the GMP lab, gown up, and do all those things. The scale that we're working on, again, is in this 50 ml to 1.5 liter, which is an autologous CAR T space. We do have developmental projects looking at other scale types. All right. Thank you guys for your time. I'm here for other questions, or I'll race you to lunch.